So, the urinary system, also known as the excretory system, is the body's natural filtration and waste management network. It works continuously to keep internal chemistry in perfect balance by filtering blood, removing waste, and regulating water and electrolyte levels. This system is composed of four main organs: the kidneys, ureters, urinary bladder, and urethra. Together, they maintain homeostasis by eliminating nitrogenous wastes, such as urea, creatinine, and uric acid, while precisely controlling blood pressure, pH, and electrolyte concentrations, including sodium, potassium, and calcium. Beyond waste removal, the urinary system plays endocrine and regulatory roles. The kidneys produce erythropoietin, EPO, a hormone that stimulates red blood cell production in the bone marrow, renin, which regulates blood pressure through the renin-angiotensin-aldosterone system, and calcitriol, the active form of vitamin D, crucial for calcium absorption and bone health. Through these mechanisms, the urinary system supports nearly every other body system, from cardiovascular and skeletal to endocrine and immune. So, the kidneys and nephrons. Kidneys are bean-shaped organs located on either side of the spine, just below the ribcage. Each kidney is about the size of a fist and remarkably efficient, filtering roughly 1 liter of blood every minute. Inside each kidney lie over 1 million microscopic filtration units called nephrons, which are the true functional cores of the urinary system. Every nephron works independently to form urine through three main steps. Filtration. At the glomerulus, blood enters the nephron via a small knot of capillaries known as the glomerulus, located within Bowman's capsule. Here, blood cells and large proteins are retained while water and small solutes, like glucose, salts, and urea, are filtered out into the capsule. Reabsorption in the tubules. As the filtrate moves through the proximal tubule, loop of Henle, and distal tubule, the body reclaims what it needs. Most of the water, glucose, and essential ions are actively reabsorbed into the bloodstream, and secretion into the tubules. Additional wastes, such as hydrogen, potassium, and creatinine, are secreted from the blood into the filtrate to fine-tune chemical balance before urine formation. The kidneys also regulate acid-base balance by controlling hydrogen ion excretion and bicarbonate reabsorption. Through these processes, they maintain electrolyte equilibrium, blood volume, and osmotic pressure, vital for healthy heart and nerve function. Blood exits the kidneys via the renal veins, while urine flows out through the ureters, ready for temporary storage in the bladder. The ureters are two narrow muscular tubes, one extending from each kidney, that carry urine downward to the bladder. Each ureter measures about 25 to 30 centimeters long and is lined with transitional epithelium, allowing flexibility as urine passes. Their walls consist of smooth muscle that rhythmically contracts every 10 to 15 seconds through peristalsis, ensuring a steady one-way flow of urine. At the point where each ureter enters the bladder, a valve-like mechanism prevents urine from flowing backward, a crucial safeguard against infection or kidney damage. The urinary bladder is a hollow, muscular organ located in the pelvis, serving as the temporary reservoir for urine before elimination. It can expand and contract depending on its contents, thanks to its transitional epithelial lining and the detrusor muscle in its wall. Within its internal structure lies a smooth triangular region known as the trigone, bordered by the two ureteral openings and the urethral outlet, an important anatomical landmark involved in signaling the urge to urinate. A typical bladder comfortably holds about 400 to 500 milliliters, roughly 2 cups of urine. Once it's full, nerve signals from the bladder will communicate with the brain, coordinating the urge to void and the relaxation of sphincters. The urethra is the final channel in the urinary system, conducting urine from the bladder to the body's exterior. In males, the urethra is short, about 4 centimeters long, making urinary tract infections, UTIs, more common. In males, it's longer, approximately 20 centimeters, and passes through the prostate and penis, also serving as a conduit for semen. Two sphincters regulate the release of urine. The internal urethral sphincter, involuntary smooth muscle, keeps urine retained in the bladder. The external urethral sphincter, voluntary skeletal muscle, allows conscious control during urination. Together, they provide both continence and control, allowing the bladder to store urine safely until it's socially and physically appropriate to void. Each minute, the kidneys filter about 1 liter of blood, yet only 1 to 2 liters of urine are excreted daily due to the extensive reabsorption processes occurring in the nephrons. This ratio reflects the body's efficiency at conserving vital substances while eliminating toxins. A key indicator of kidney function is the glomerular filtration rate, a measure of how much blood is filtered through the glomeruli per minute. A healthy GFR typically ranges between 90 to 120 milliliters per minute. Urine output can vary widely depending on hydration, diet, temperature, and health. So we've got polyuria, excessive urine production over 3 liters a day. We've also got oliguria, low urine output like sub 0.4 liters per day. And we've got anuria, complete absence of urine output, often signaling severe kidney dysfunction. Normal urine is about 95% water, with the remainder consisting of urea, creatinine, electrolytes, and small organic compounds, each revealing insights into metabolic and renal health. So this was way too much information, I know, but there is a lot to talk about. So I will just summarize this anatomical and functional part, and we will get to how to enhance and support the urinary system. So in summary, the urinary system eliminates metabolic waste such as urea, uric acid, and creatinine, regulates blood volume and pressure through fluid balance and the RAAS mechanism, maintains electrolyte equilibrium and acid-base homeostasis, stimulates red blood cell production via erythropoietin, and activates vitamin D, calcitriol, essential for calcium metabolism and bone strength. These combined functions make the urinary system indispensable for detoxification, cellular health, and internal balance. So, how to support and enhance the urinary or excretory system? So here we don't have a bazillion options. The most obvious one is drink water. Hydration. Not alcohol hydration, water hydration. So yeah, the simplest yet most powerful way to support kidneys and bladder health is adequate hydration. Drinking enough water helps flush toxins, prevent stone formation, and reduce infection risk. Beyond plain water, certain beverages can enhance kidney function. Citrus-infused water, unsweetened cranberry juice, pomegranate juice, and watermelon juice aid hydration and reduce inflammation. Herbal teas like green tea or chamomile add antioxidant protection and mild diuretic effects. Hydration should be steady throughout the day rather than concentrated at once. Pale yellow urine is a good indicator of proper fluid balance. You will also need a balanced and nourishing diet. Nutrition directly influences urinary tract and kidney function. A plant-rich, low-sodium and antioxidant-packed diet helps protect delicate kidney tissues. Beneficial foods include blueberries, cranberries, apples, red grapes, and pomegranates. They are rich in antioxidants that lower inflammation and protect renal cells. We've got papaya, watermelon, sweet lime, and jamon. So they are hydrating fruits that support detoxification. And cruciferous vegetables like broccoli and red peppers enhance immunity and kidney health. You clearly should avoid excessive salt, added sugars, and highly processed foods which can increase kidney strain. And also, obviously, caffeine, alcohol, spicy foods, and artificial sweeteners, especially if you're prone to bladder irritation and incontinence. So we're getting the blueprint for the overall body's health, which is our 4 pillars: a proper diet, hydration, sleep, or if you want, rest, and physical activity. And we get a glimpse of what, let's say, the bad stuff is for our body: caffeine, alcohol, ultra processed foods, added sugars, etc, etc. So even though some people recommend coffee, I personally won't. But if you want to see a video on this topic, let me know in the comments and I'll see what I can do. Because many people say, yeah, caffeine is good, drink coffee like maximum 300 to 400 milligrams of caffeine per day for an adult, but it also has its downsides. So let me know in the comments and I'll maybe make a video about it. Let's move on to lifestyle habits. Healthy habits strengthen the urinary system's long-term resilience. Stay physically active to promote circulation and efficient kidney filtration. Maintain a healthy weight, since obesity raises the risk of kidney stones and disease. Manage blood pressure and blood sugar, as hypertension and diabetes are leading causes of kidney damage. Limit NSAIDs and painkillers, which can harm kidney tissue over time. Quit smoking and moderate alcohol, reducing the risk of bladder and kidney cancers. And cook with healthy fats such as extra virgin olive oil to lower inflammation and support vascular health. Also, empty your bladder regularly. Don't hold it in for long periods as it increases infection and retention risks. Practice proper hygiene. People with vaginas should wipe front to back and urinate after intercourse to prevent UTIs. And avoid irritants, including caffeine, citrus, and carbonated drinks if you experience urgency or frequency issues. Also, you should strengthen your pelvic floor. The pelvic floor muscles support the bladder, urethra, and the reproductive organs. Regular Kegel exercises can prevent or reduce urinary incontinence and improve bladder control. Techniques such as biofeedback or vaginal cones can help individuals train and isolate these muscles effectively. Certain herbs have traditional roles in supporting kidney and urinary health. We've got ginger. Anti-inflammatory, improves circulation and protects kidney tissue. Marshmallow root acts as a natural diuretic and soothes the urinary tract. Giloy, also known as Tinospora cordifolia, helps lower uric acid levels, potentially reducing stone risk. And coriander and nettle leaf promote mild detoxification and may reduce inflammation. So this is very important. Always consult a healthcare professional before starting any herbal supplement, especially if you have existing kidney disease or take prescription medications. So I forgot to tell you, but this video is just for informational purposes. Informational purposes only. So I am not a doctor, and if you want to bring changes into your life, please consider talking to a doctor and not just blindly listening to some guy on the internet, okay? So once again, this is just for informational purposes only. And finally, we've got UTI prevention and relief. Urinary tract infections are among the most common bacterial infections, particularly in women. Prevention focuses on hydration, hygiene, and diet. Drink plenty of fluids to flush bacteria. Include cranberry juice, green tea, hibiscus, garlic, blueberries, and probiotics. They may help prevent bacterial adhesion to the urinary tract lining. And seek prompt medical care for symptoms such as burning urination, fever, or back pain to prevent kidney involvement. So, the summary. The urinary system is a silent but tireless guardian of internal stability, filtering our blood, balancing electrolytes, and eliminating waste every minute of every day. When supported through mindful hydration, proper nutrition, and healthy lifestyle habits, it rewards us with lasting vitality and balance. Protect your kidneys, care for your bladder, and respect your body's signals, because good urinary health is essential to whole body wellness. Ladies and gentlemen, that was the urinary or excretory system. We will meet next week for the immune and lymphatic systems. Take care.